So how long have you been practicing surgery, doctor?
Well, I have been in neurosurgery in private practice since 1987, so it is 27 years.
So what inspired you to enter medicine?
Well, medicine was a field that I became initially interested in when my sister became ill with leukemia. And we were very close, and she had a lengthy illness before she expired. That was my initial exposure to medicine. And after that experience, I felt very strongly that this was the field that I wanted to pursue. I felt it would be an incredibly rewarding and blessed way to live.
How did that experience with your sister affect your practice today?
Well, I think my family situation, and not just with my sister, my father had an unfortunate accident. He ended up actually dying from a neurosurgical problem, which then led me into neurosurgery. But those kinds of experience have helped me understand what my patients are going through in times of unfortunate tragedy. Fortunately, these situations are rare, but I do think it's given me the opportunity to relate in a closer, more meaningful way with some of my patients because I have been on the other side of this fence.
So you mentioned before that your patients have to obviously trust you, and how do you help them in some of these life-threatening situations? How do you support them in these ways?
I think the main support is to do everything you can to help their medical problem. That's the number one thing. You want to do everything you can to help them deal with their health issues. And aside from that, they have to know that you are supporting them in other ways, and the family. Lots of medicine isn't just treating the patient. Sometimes a lot of it is treating the family as well. And I think that's important to understand.
You mentioned that sometimes they say, they're actually putting their life in your hands. How does that make you feel? Talk to me about that.
Well, I think that's a very honorable and important responsibility you never take lightly.